You know, not every life-threatening emergency comes crashing in with sirens blaring. Sometimes the most dangerous situations don't shout at all. They whisper. Today, we're going to decode those really subtle, super easy-to-miss signals our bodies send us when something is seriously wrong.
So think about this for a second. Is that sharp pain in your chest just a pulled muscle from the gym? It's a question, right? We've probably all been there. Our first instinct is to just brush it off. But what if that simple explanation is dangerously, completely wrong? Let's dive into a real story that starts with that exact thought.
First up, we're talking about a deceptive pain. A symptom so misleading it almost led to a total disaster. Let's see how this all played out.
Okay, so let's meet a 38-year-old software engineer. He starts feeling this sharp pain on the right side of his chest. It gets worse when he takes a deep breath, and it's sore if he touches it. So 2 days later, he sees a doctor who says, yep, sounds exactly like a pulled muscle, but here's the thing. 5 days go by and the pain is still there, it hasn't budged. So he heads to the ER, and that's when things take a turn. They run a specific blood test and it comes back abnormal. That test result is what makes them say, okay, we need a CT scan. And that scan changes everything.
And boom, here it is. This image is the scan from his case report, and it just perfectly illustrates the danger. That arrow isn't pointing to a strained muscle. It's pointing to a blood clot wedged deep inside his lung. What felt like a simple everyday injury was actually a pulmonary embolism, a really serious and potentially fatal condition.
So a pulmonary embolism, or PE, is a major blockage. It's a full-on cardiovascular emergency that, in this guy's case, was pretending to be simple chest pain. It's the perfect example of a dangerous whisper. And you know what? It leads us right to an even more common silent threat.
All right, let's see how this whole hidden danger idea applies to something you've definitely heard of, the silent heart attack.
Take a look at this number. Just let it sink in for a second. 45%. What in the world could this be referring to when we're talking about heart health?
Well, here it is. It's pretty shocking, but studies suggest that nearly half of all heart attacks are silent. They happen without any of those classic, dramatic symptoms you see in the movies, which of course means they often go completely unnoticed.
The official name for this is a silent myocardial infarction, or SMI. And let's be super clear about this. Just because the symptoms are quiet, it does not mean the damage is minor. The harm to the heart muscle is just as severe as a full-blown, chest-clutching, fall-on-the-floor heart attack. The body's alarm bells just aren't ringing.
So if it isn't crushing chest pain, what does a silent heart attack actually feel like? Let's break down those really subtle symptoms.
This chart just lays it out so perfectly. On the left, you've got that classic Hollywood heart attack we all recognize. But look at the right side. These are the whispers, just some vague discomfort, maybe a little pressure, pain in your jaw or neck or even your stomach, and that unexplained deep fatigue. These are symptoms that are so easy to just dismiss as something else. Let's really focus on these 4 key whispers. First, there's this profound fatigue that no amount of sleep seems to fix. Second, discomfort in places that seem totally unrelated, like your jaw feels like a toothache, or you think you have a stiff neck or bad acid reflux. Third, getting out of breath from doing simple things, like walking up a few stairs. And finally, that feeling of nausea or indigestion that's new or feels way more intense than usual. These are the signals that we mistake for something else all the time.
And this brings us right back to our software engineer. His own words just hit so close to home, right? It shows you exactly how easy it is to get it wrong. He said he was shocked. He rationalized his pain. He came up with a simple explanation for a life-threatening problem. And that is exactly what happens with silent heart attacks.
Okay, so now we know what to look for. The next logical question is, who is most vulnerable here? Who really needs to be paying attention?
Okay, get ready for this number. Every single year, in the US alone, 8 million people go to the emergency room complaining of chest pain. That's just a staggering number. But here's the challenge for doctors. Of those 8 million visits, less than 5% are actually having an acute heart event. So for medical professionals, finding the real emergencies, especially the quiet ones, is like trying to find a needle in a massive haystack.
So who needs to be extra vigilant? Well, the risk factors on this slide probably look pretty familiar. High blood pressure, smoking, family history. But I really want you to focus on that first one, diabetes. Here's why. Persistently high blood sugar can actually damage the nerves that are responsible for sending pain signals to your brain. It essentially turns down the volume on your body's entire alarm system, making it totally possible to have a heart attack without feeling that classic intense chest pain.
But look, it's not all doom and gloom. Not at all. There is good news. And it all comes down to this number, 50%.
And here's the crucial takeaway. You have power here. By actively managing these risk factors, I mean really getting a handle on your blood pressure, your blood sugar, making those lifestyle changes, you can slash your cardiovascular risk by as much as half. This isn't just about preventing a problem, it's about taking control.
All right, let's bring all of this together. It's time to turn all this awareness into real, concrete action.
Here are 4 simple but incredibly powerful steps you can take. Step 1, know your risk factors. Know your own health history, your family's history. Step 2, just listen. If a new symptom shows up and it sticks around, pay attention to it. Don't just brush it off. Step 3, trust your gut. If you have that little feeling that something is just off, it probably is. And finally, step 4, be your own advocate. Remember her guy from the case study? His pain didn't go away, so he went back and got more help. And that single decision made all the difference.
So at the end of the day, the real challenge is just learning to listen to our bodies, especially when they're whispering instead of shouting. So I'm going to leave you with this one simple question to think about. What is your body trying to tell you?